Welcome back to another episode of the Your Houston podcast. We're excited to be here in person for the first time since 2020 with Cindy Tessler, the Vice President of Program and Operations for Avenue CDC. Cindy's an experienced nonprofit and community development professional, has a degree from Texas A&M University in sociology, and a master's in nonprofit accounting from Notre Dame. We have a lot to talk about, so let's get started.
I feel the liftoff. The clock has started. Roger.
All right, so we're going to start with our first question. What is your favorite restaurant in Houston?
I'm going to go with a real easy one that's been a family favorite since I was little, Mambo Seafood on Long Point.
Oh, yeah.
My dad, we're Colombian. My dad lives in Colombia, and whenever he comes to visit, the first place we go to is Mambo. You get that shrimp, fried rice, the oysters, the fried fish is delicious. So Mambo's an easy one.
That's a great choice. And they have one up off of 45 too.
Yeah.
That's the one we used to go to, but
yeah, it's
everywhere. Delicious. Okay, so you're an Aggie.
I am an Aggie.
Yep, same here.
Yeah, I saw the ring.
Favorite memory from College Station?
Just the microcosm of like going to the grocery store and there's no adults there. And it's just you and a bunch of other teenagers trying to figure out what to eat this week. It was kind of mind blowing to get there and figure that out.
Yep.
We're all the adults. It's us.
Yeah. Now we're the adults.
Yes. Yeah.
What's your ideal vacation?
In the woods, like find a cabin in the woods and bring like 3 books and actually like read them all. Like just be outside, get cozy inside, go by the lake, but just be able to like be somewhere nestled away and like actually get a chance to read would be fantastic.
Mm-hmm. There are some spots not too far from Houston.
Yeah.
You can do a drive, hour and a half, and you find some wilderness.
Yeah. So there's actually like I don't know if you've heard of like the Lake Houston State Park.
Yep.
But they do these like really cool little A-frames that you can stay in, and I love that place. It's an easy 45-minute drive from here, and it's really nice and secluded.
Yeah. All right. Well, thank you so much for being here. And we're glad to get to know you a little more and then also learn more about Avenue CDC, which CDC stands for Community Development Corporation. Can you tell us what a Community Development Corporation is?
Yeah. So the basis for a CDC is really figuring out what are the housing needs of a particular community and how do we work together to solve them. And so it's about coming together with community voices to figure out what a particular neighborhood needs. So we currently reside in the greater north side and near north side, and that's where we build our buildings. So it's not like we have our offices in a different neighborhood and our building somewhere else. It's about being in the community that you're in, listening to those community voices and coming up with solutions together.
That's really important because a lot of times you'll find organizations that show up and say, hey, here's what we're going to do to your neighborhood to make it better.
Yeah.
And they don't ask the residents, they don't seek input or feedback or get to the time to get to know them. And y'all being in the community makes a big difference when you can say, hey, we have seen this problem or we want to work with you on these issues. We've experienced them ourselves.
Yeah. You may know, or some of your listeners may know about Avenue from the Little Blue House. So for the longest time, for about 15 years, we were housed out of a little bungalow in the near north side, a Little Blue House, La Casita Azul. And people would just know, like they would come in and they'd be like, my friend told me about the Little Blue House, or my cousin came to the Little Blue House. And it really was a staple of the near north side to have that home that was a representation of what we could do for you, either helping you through homebuyer education or counseling or foreclosure prevention. And so I really think that's a big part of what Avenue does.
Okay, so let's talk more about the program specifically. So you want to help with affordable housing in the neighborhoods. How do y'all that's a big issue. How do you go about tackling that?
Yeah, so there's kind of two main areas of Avenue. One is our real estate development side. So we are developers. We do develop affordable single-family homes as well as multifamily apartments. And then the other part of our work is really the client-facing kind of asset building work, which revolves around comprehensive community development work in the near north side around safety, infrastructure, police relations, education, beautification projects. And then we do homebuyer education and counseling, which really helps families build generational wealth for their kids.
Okay, so let's start with the homebuyer education. If somebody is interested in, or maybe they don't even think they could qualify, right? They think home ownership, that's not for me, where could they get started?
Yeah. So we are a HUD certified housing counseling agency, which means that we provide that HUD certified 8-hour class that any first time home buyer needs if they want to apply for down payment assistance, or if they're getting a loan for the first time, or if they're trying to get special benefits from lenders if they're a low income family. And so the class is really that basis to even get you to figure out what the next step is, if it's right for you. So a lot of people say, I know my credit's bad, or I know I don't have savings, so I'm not going to take the class until I improve those things. But they don't really know what to improve. They don't really know what the actual metrics or standards are. So we tell everybody the class is the first step. Regardless of whether you're ready or not, that will actually tell you, hey, should I start working on these things? Should I take that next step, or do I still need to wait a few years? But that class is really that first step before you even know if you're ready or not.
That's a great resource, because even if you think in your head, I wouldn't know how to even start.
Yeah.
Getting that information, and these are the things you work on to be at a place to purchase a home, and helping guide people through those check marks. It's so important, because it can be overwhelming, that whole process.
Yeah, it's definitely overwhelming for families, especially for first-time families, for BIPOC families that have never purchased a home before. A lot of people rely on their parents or trusted, older siblings or older relatives to help them in their first home buying process. But if you're first generation American, your parents maybe didn't have that experience. And so you do really feel alone. And so that's why all of our, because we are on the near north side, all of our services and our programs are in English and in Spanish. So all of our staff are Spanish speaking, all of our materials, because we do serve a large Latino population. And so we want to make sure that we are equitable in the way that we provide information to them as well.
And just so people get an idea, what type of income range are we talking about for the homebuyer program?
Yeah. So our first-time homebuyer program is actually open to everyone. Most people that take it, it's because they want to apply for down payment assistance, but the first-time homebuyer program is for anyone of any income range. You do get that certificate that allows you to go and apply for down payment assistance. As far as the income range for that, right now the only program that's available, the largest one, is the City of Houston, which is $30,000. And for a family of 4, you can be making up to $91,000 and still apply for down payment assistance. So there is a wide range, because affordability is it is so tough and tight right now that down payment assistance is needed for a larger range of families than before.
And is there a waiting list for that, or?
Yeah, so the city, there is a waiting list, so that's why it's really important to kind of get into homebuyer education as soon as possible and counseling, and you have your homebuyer counselor after you take the class that kind of guides you through the process so that you're not in it alone. And
this is for first-time homebuyers or anyone who wants to purchase a home?
So what's really good about these down payment assistance programs is that usually, they are marked for first-time home buyers, but they define first-time home buyers as not having owned a home in the past 3 years. So it doesn't actually have to be your first home ever, just so long as you haven't owned a home in the past 3 years, then you can apply.
It's good to know. Now, shifting to renters, you mentioned multifamily. What programs do y'all offer for folks who are looking at an apartment?
Yeah, so all of our properties are called mixed income properties. So that means that a certain portion are set aside at market rate for market rate renters, and then a certain portion are set aside for lower income families on a sliding scale. So it really just depends on your income, what rent you're going to pay. And the real benefit to having mixed income communities is that research shows that when you create a development for just low income families, there aren't really any meaningful gains in education, in income, in socioeconomic status. But when you do a mixed income development, they find that low income families actually do, kids do better in school, families actually strive a little harder and work a little harder and can actually move in socioeconomic status. And there is no adverse effects to market rate renters and buyers. So that's the formula that we use. And so it's a really great way to create a multifamily apartment complex.
That is a great model, and it's good that's being incorporated into neighborhoods because, like you said, if you build just a low-income development and then you cluster that with other low-income developments, you're not going to help those folks give them a chance to succeed like if you do it in a mixed setting. So.
Yeah.
That's really great.
And, whenever we talk about, we do affordable housing, I think the prevailing mindset is, like HUD housing or the Housing Authority or Section 8. And it's really not like that anymore. HUD has made a lot of strides and affordable developers have made a lot of strides that you could be driving by a affordable housing development and not even realize it, because people that are lower income should not have to live in a place that's any different from anybody else. And so I think that's what Avenue does really well, is making sure that people really do have quality, safe places to live that are affordable.
That's wonderful. Beyond housing, what other programs and services does Avenue provide?
Yeah, so one of kind of our flagship programs has been our comprehensive community development work. So we received funding from a fantastic partner, LISC, over 10 years ago to engage in what's called a Go Neighborhood. And it's really about being in a neighborhood and creating a kind of team of collaborative community partners, for-profit partners, and community residents themselves to decide what it is that they want for their community. What are the changes that they want to see, and how can they themselves implement those changes? So we've been doing that in the near north side for over 10 years, and now we are in the Northline neighborhood, which is 77076 and a little bit of 77022, doing that work all over again and really kind of tackling that with the residents there that are very different from the residents in the near north side and that have very different needs. But it's all about asking the question and being willing to get in, in the weeds and figure out how we can co-create a solution.
It's so important to tailor these solutions to the neighborhoods because they're different, like you said, and they have different needs and different circumstances. And it's an approach we here at Your Houston take with our community engagement, and that is, really focusing on local issues and asking people what they care about in their neighborhoods that they want to see better or they want to put time and effort to improve. And so the fact that y'all are doing that, I think, is just a testament to, really trying to build and work towards something that gets buy-in from the community and is something that they're going to want and appreciate because they're involved in that process.
Yeah, and I mean, it's so fantastic that Your Houston is here and has that aim, because it feels really good for community members to hear that organizations are talking about them, or that they're focusing on them, or that they're even a part of the conversation. So to get organizations on to do these type of initiatives, we are actually part of a health collaborative initiative that's really beneficial to the neighborhood.
So speaking of that, we received a grant to do health equity work in 11 zip codes in Houston, which we're very excited to get off the ground doing. But it's meant to address longstanding underlying health equity issues. And so it could be a lack of quality food, it could be a lack of services, a lack of information, transportation to services. I mean, you name it. These are things that are longstanding and that were sort of bubbling under the surface. Our objective is to really build coalitions that will address those issues in the zip codes in a way that is long-term and sustainable, so that when we aren't funded to do the work, those partners in that coalition can still help make sure there's a farmer's market there every other week, or there's a mobile clinic coming once a month that seniors can access, or folks who don't have insurance and there's no clinic around can access, because those are the things that are going to, start to chip away at those underlying health issues.
Yeah, I mean, you're absolutely right. So much of health equity and really making sure that people are healthy comes down to things that have nothing to do with medical care. 40% of people's health is around their socioeconomic factors. What are their education? What is their job status? What is their income? What is their support system? 20% is their health behaviors. What do they choose to do? How much alcohol do they intake? How much tobacco? Do they go on walks or things? And then 10% is the physical environment. Are they close to a park? Is there a lot of pollution in the air? Things that they don't have any control over. That's 10% of it, and only 20% is really attributed to like access to care and the quality of care. So much about health equity in the community really has to be in the community. The answers aren't going to be with healthcare providers. And so that's what our health equity work is around. We have what's called an accountable community for health, an ACH. This is a model that's been used kind of around the country. It's pretty new, and so we're trying to figure out what that looks like. And it's comprised of community partners and clinical partners in trying to look at three main areas in the Greater North Side: access to care, access to healthy food, and active living. And so Avenue, along with the YMCA, Legacy Community Health Clinic, Memorial Hermann, Community Benefits Corporation, and Wesley are really trying to tackle this together to see what are those non-medical drivers of health that we can address in the community.
So what would success look like for y'all in that program once the program winds down? What would you like to see at the end of the day?
Yeah, I'd really like to see a greater agency for individual residents in their health. I think so much of healthcare comes down to what clinics decide to show up, which fairs are holding blood pressure readings, who's doing your diabetes screening at the library. And so there's not a lot of autonomy in health. And so it's really about educating the residents so that they know that they do have autonomy and agency in what their health looks like. And so we're really pushing right now just to increase the awareness and increase the education of residents, because there's so much that they can do that has nothing to do with healthcare to increase their health.
It's so true, and that's the work that we're also focused on at the moment as well. And as we talk to partners and as we talk to residents, we were just at a senior center the other day, and we were trying to get them signed up for health information alerts, because there's a lot of valuable information that's shared through these alert systems that a lot of people don't know about. Yeah. And it's resources, it's programs, it's initiatives in the neighborhoods about a cooking class to show you how to, cook healthier to manage your diabetes, or if there's an air quality issue, things you can do to help mitigate that at home. But getting that information out and having people take more involvement is key, because, we can do as much as we can, but at the end of the day, other people have to be involved in those factors that are, not necessarily clinical, but make a big impact.
Yeah, and that's where having a lot of different voices at the table is really important. It has to be a collaborative between multiple different types of partners, even partners that you may not realize are beneficial. It's about having a lot of different people tackling. Many hands make small work, especially with something like this. You got to involve schools. You have to involve employers. What is it that employers want for their employees? They want to have healthy employees. So how do we bring employers into the mix to say, hey, you have some agency here to make the lives better for your employees?
I'm glad you said that. One of the reasons we were chosen for this project is because we were not the traditional organization that has always received funding for this work.
Yeah.
Because they get the same result every time, right?
Yeah.
They talk to the same folks, they work with the same groups. We're trying to reach folks that are harder to reach or that are not engaged. And so you've got to think outside the box. You've got to work with non-traditional partners.
Yeah.
And it could be a barbershop.
Yeah.
It could be a chamber of commerce. These are groups that we've engaged that wouldn't traditionally be engaged, but they provide a vital link to communities. They have a trusted voice. Neighbors and residents look to them. And so we can say, hey, we're sharing this information out, or fill out our survey, and you're able to see what's going on the ground in the communities. But you're not going to do that if you do the same thing over and over and over again. And so those different partnerships, those many voices, are a key part.
Yeah. And I think that comes back to kind of being innovative in the way we think about health or even housing. All of these, accountable communities for health that they have around the country, most of them, there's a backbone agency. There has to be one kind of central agency that's helping lead the work. And a lot of times it is a healthcare provider or a health payer, a health funder. And so for us, we're a housing agency. And so it's something a little bit different. But I think a lot of health comes back to your home, right? Having a safe, quality, affordable place to live does attribute to your health, right? Not being housing burdened, paying more than 33% of your monthly income on rent helps you to be healthier. So I think Avenue is really well positioned to kind of be in that place to start having the health conversation, because so much of our mental health and our well-being comes back to feeling safe and secure at home. And then we can tackle other things. Families, we find renters and even home buyers, the first thing they usually do is pay their mortgage or their rent. Like, that has to happen. You need a roof over your head. And so because they do that, they forego other necessities sometimes, going to the doctor or getting prescription medication or doing regular checkups for their kids, because they have to pay rent first. And so really tackling that affordability is important to us. And so I think I mentioned to you earlier, we have a social impact fund to try to preserve affordable housing. And that is really another place that we can tackle the health of our neighborhoods.
So you have a social impact fund that helps keep the house affordable if a family sells, or if the taxes get too high. What do you mean?
Yeah, so actually, so we are real estate developers. So all along, we've always developed multifamily apartment complexes. And so a new part of our work is actually preserving the affordability of existing housing structures. Mm-hmm. So there are apartment complexes that are called NOAHs, naturally occurring affordable housing. And so that means that these are apartments naturally they have kept their rents affordable. The market hasn't increased them in disproportionate ways, and so the families that live there just naturally live in affordable housing. But those are at most risk for investors to come in, make some improvements, and jack up the price on rent. And so an organization like Avenue can be working to build new affordable units, but then the older apartment complex, which is a Class B or a Class C apartment complex next door, could be bought by a developer, and all of those units that were affordable were lost. And so what Avenue does is we're working to, hopefully purchase these at a good price, make repairs and improvements to them, but keep the affordability there for families. So we're working on both sides of it, developing new units as well as preserving existing units for affordability.
It's so necessary. I used to serve on the board of the Houston Land Bank.
Oh, yeah.
And so the catch-22 is always you're building affordable single-family homes, but then as soon as a family sells, it's market rate. And so that affordability is lost. How do you keep the affordability, and you try and figure out ways to, keep that, because that, you don't want to lose it.
Yeah.
The mayor has this big initiative to try and build 3,000 affordable homes before the end of his term. And so, everyone's really trying to make this push, and it's so necessary.
Yeah.
So trying to figure out ways to keep that affordability long term, that's going to be a huge way to help keep those units for future families.
Yeah, and that's on the multifamily side. And on the single family side, we have the Houston Community Land Trust, which maintains affordability for single family buyers. So anybody that's purchasing a home that's low income, they can purchase it, at a lower rate, and then it stays affordable even after they choose to sell it, because what they own is the structure and not the land. But the land, the home is theirs. They have a 99-year lease. It's a really fantastic model for long-term affordability. And that's one of the innovative kind of solutions that the city of Houston has chosen to invest in. But a lot of families are afraid because they don't know what that is. Yep. It's new. And so that's where, going to a HUD certified housing counseling agency is really so important, because we always say we're the only organization in the home buying process that doesn't financially benefit from you buying a house. So we don't get a commission check when you buy a house, so we can actually just provide you really good impartial information to help you maintain your sustainability in your home for the long run.
Wonderful. Yeah. There's a lot of tools in the toolbox out there to use.
Yeah.
If people want to learn more about Avenue, interested in a program, where can they go? How can they find out more information?
Yeah, so definitely avenuecdc.org/homeownership is a great place, or sending us an email at classes@avenuecdc.org is really fantastic. And then we do regular monthly Q&A webinars. So if you're not quite sure about taking the first time home buyer class, you can always kind of log into our Q&A webinars. We try to keep them focused around, maybe it's around your savings or around new DPA programs or around, how to increase your credit, little things like that, so that people can start to understand that mortgage readiness is a whole host of things. And so you may be bogged down on your credit score, but maybe your debt to income is what you should be focusing on. And so it really paints a good picture of what mortgage readiness looks like. And I always tell people all the time, if homeownership is anywhere in your mind and you're just not sure that you're ready, take the class and you'll really you'll have an action plan for when you do want to get ready. Especially right now in, what people are saying is a recession. People are like, well, I don't want to get into it just yet. But it's not always going to look like this. And so you don't want to have wasted this time thinking I'm not ready and the market doesn't look good. Take this time to really prepare your finances, know exactly what you need to do to prepare your finances. And so take the class, come to counseling.
Credit can be a burden to someone who's potentially looking at buying a house if it's bad. Are there programs or services that you offer to help people improve their credit before they go further into the home buying process?
Yeah, one of the new kind of innovative things that we're trying out that we haven't done before and we haven't seen any other organizations try before is a match savings for credit program. So there are traditional match savings programs where if you save a certain amount of money, we will match it for you to use towards the purchase of your home. But this one is all about folks that have lower credit scores and they know they need to work on their credit. Either they have low credit or no credit. And so a secure credit card is a really safe way to start building credit if you're on that home buying process. So what we're going to do is we're going to do a $250 match. If you have $250, we will match you $250 so that you can apply for a secure credit card and start building your credit that way.
The homebuyer education course sounds like a great resource and also a very vital step in this process. Is it only offered at your facility, or how else can people take the class?
Yeah, so we offer the class in two ways. They could either come in person or they can join virtually. So you can do the class virtually, the full 8 hours from the comfort of your home. Another benefit that we have in offering our first-time homebuyer class is offering it at a reduced rate for employers. Right now, a lot of employees are really seeking for additional benefits, and they really want to make sure that the places they work are seeing them as a whole person and that they want them to thrive. And being an employer, you can actually ask Avenue to come and do a class for a flat fee. So you can offer it to all of your employees that may be interested in homeownership for a flat fee, and they get the certificate and they can move on to homebuyer counseling at no cost to them. And it's really a nominal fee for the employer to offer it as a benefit.
Oh, that's wonderful that y'all will go out on site and give the class to a large group. That's fantastic.
Yeah, absolutely. And so we hope that a lot of employers will think about that this year as a retention tool and really as an asset building tool for their employees.
All right. It's an 8-hour class. It's free.
So the class is $50.
Oh, it's
so the
50,
class
okay.
The class is $50. Yeah, no worries. And then after that, the homebuyer counseling is always at no cost. So you can meet with your homebuyer counselor as many times as you want, and they're the person that's going to kind of walk you through all the steps of homeownership, walk you through any mortgage documents if you have any questions, and there's never a cost for homebuyer counseling.
All right. Well, thank you so much for spending some time with us and sharing all the resources and programs that Avenue CDC has to offer and the great work y'all are doing out in the community. We really appreciate it, and we look forward to working with y'all in the future.
Thank you so much, Maria. I really appreciate it. It's fantastic.
Thanks so much, Cindy, for taking time out of your day to tell us all about Avenue's programs and services. If you're interested in learning more or taking their homebuyer education course, go to avenuecdc.org. And if you want to get involved in the Your Houston Health Initiative, check out yourhou.com and send us a message. Don't forget to like and subscribe to our YouTube channel. We'll be back soon.